Imagine this, every 2 seconds, someone in the world is diagnosed with diabetes. Yes, you heard it right. This startling fact underscores the need for us to understand this global health menace. In the coming minutes, we'll delve into the what, why, and how of diabetes, shedding light on its causes, risk factors, and much more. We'll draw upon reliable resources like the National Library of Medicine and the Centers for Diseases. So brace yourselves as we embark on this enlightening journey. Stay tuned to uncover the hidden truths about this worldwide health concern. So what exactly is this condition that's taking the world by storm? Well, let's break it down. Diabetes is a chronic health condition that affects how your body turns food into energy. When you eat, most of your food is broken down into a type of sugar called glucose. This glucose then enters your bloodstream, and with the help of a hormone called insulin, it's allowed to enter the cells in your body where it's used for energy. However, in a person with diabetes, this system doesn't work as it should. There are two main types of diabetes. In type 1, your body doesn't produce any insulin. In type 2, which is more common, your body either doesn't make enough insulin or doesn't use it well. As a result, glucose stays in your bloodstream and doesn't reach your cells, which can lead to serious health problems over time. Diabetes isn't just about high blood sugar, it's a systemic disorder that can affect your heart, kidneys, eyes, and nerves. It's a condition that requires daily management. But with the right tools and knowledge, it's entirely possible to lead a healthy life. Now that we know what diabetes is, let's delve into what causes it. What if we told you the food on your plate could be a ticking time bomb? Yes, the causes of diabetes can be as close as your dinner table. An unhealthy diet loaded with fats and sugars can lead to obesity, a significant risk factor for type 2 diabetes. However, it's not just about what's on your fork. Lack of physical activity is another culprit. Regular exercise helps control weight and increases insulin sensitivity, reducing the risk of diabetes. So, if your idea of a workout is a Netflix marathon, it might be time to rethink your routine. Of course, we can't talk about causes without mentioning genetics. Just like the color of your eyes or your height, a predisposition to diabetes can run in families. If a close relative has diabetes, your risk of developing the disease increases. But what if you've been dealt a bad hand in the genetic lottery? Well, that's where lifestyle changes come in. Remember, genes load the gun, but lifestyle pulls the trigger. It's not just about what you eat, there's more to the story of diabetes. Sometimes the danger lies where we least expect it. Let's dive into the risk factors of diabetes. It's a common belief that sugary foods are the main culprit, but actually, the risk factors are quite diverse and they might surprise you. Age is one of the most significant factors. As we age, our body's efficiency in processing sugar decreases. This is why people over the age of 45 are at a higher risk. Next, we have family history. If your parents or siblings have diabetes, your chances of developing it increase. This is due to the genetic component of the disease. Carrying excess weight, especially around the abdomen, is another substantial risk factor. Obesity causes increased levels of fatty acids and inflammation, leading to insulin resistance. Lastly, ethnicity plays a role. People of certain ethnic backgrounds, such as African, Hispanic, and Asian, are more likely to develop diabetes. Knowing the risks is half the battle, so how can we tell if we're in danger? Stay tuned as we delve into the symptoms of diabetes in the next scene. Our bodies speak to us, but are we listening? This is a crucial question when it comes to recognizing the symptoms of diabetes. One of the most common signs is increased thirst. Now, we're not talking about the normal thirst you might feel after a long walk or a spicy meal. This is an intense thirst that seems unquenchable, leading you to drink more fluids than usual. And what happens when you drink more? You guessed it, frequent urination. It's a vicious cycle that can disrupt your daily routine and sleep patterns. It's like a tap that you can't seem to turn off, and it's your body's way of trying to get rid of the excess sugar building up in your blood. Then there's unexplained weight loss. If you're shedding pounds without trying, it might seem like a dream come true, but this could be the body's response to not being able to get energy from glucose. So, it starts burning fat and muscle for fuel instead. While some people might experience weight loss, others might notice a constant craving for food. This is because despite eating, the body's cells aren't getting the sugar they need to function properly. Fatigue is another common symptom. We all feel tired from time to time, but with diabetes, this tiredness can be overwhelming, making even simple tasks seem daunting. This is due to the body's inability to use glucose effectively, leaving you feeling drained and worn out. Also, look out for blurred vision. a symptom caused by high levels of blood sugar pulling fluid from the lenses of your eyes. This affects your ability to focus. Slow-healing sores and frequent infections are also red flags. High blood sugar affects your body's ability to heal and resist infections, leading to longer recovery times. Lastly, areas of darkened skin, usually in the armpits and neck, can indicate insulin resistance, a common precursor to type 2 diabetes. It's important to remember that these symptoms can be subtle and easy to overlook, but they're your body's way of waving a red flag, trying to get your attention. These signs are our body's SOS. But how can we be sure? Stay tuned to find out more. In the fight against diabetes, knowledge is our strongest weapon. To gain this knowledge, medical professionals rely on a series of diagnostic tests. One common test is the fasting glucose test, where you're asked to abstain from eating for at least 8 hours. The test measures the level of glucose in your blood, and higher levels could indicate diabetes. Another test is the oral glucose tolerance test. This involves drinking a sugary solution and having your blood glucose levels checked after 2 hours. Again, higher levels mean diabetes may be present. Lastly, there's the HbA1c test, or the glycated hemoglobin test. This test gives an overview of your average blood sugar levels over the past 2 to 3 months. It's a longer-term indicator and can help doctors understand how well your diabetes is being managed if you've already been diagnosed. These tests are crucial, as they provide the information needed to make a definitive diagnosis. Once we know what we're dealing with, we can start to fight back. Diagnosis is the first step towards victory, but what comes next? With the right strategy, we can turn the tide in our favor. The treatment of diabetes is a multifaceted approach that goes beyond merely taking medication. It involves a combination of lifestyle modifications, medication, and in some cases, insulin therapy. It's all about maintaining a balance between diet, physical activity, and medication, to keep blood sugar levels within a normal range. Let's talk about lifestyle modifications first. This is the cornerstone of diabetes management. A healthy diet is crucial as it helps control blood sugar levels. Regular physical activity, be it walking, jogging, or gardening, can also help maintain a healthy weight and lower blood sugar levels. Medication is the next line of defense. There are several types of medications available, each with its way of helping the body handle insulin and glucose. Some help the pancreas produce more insulin, others help the body use insulin more effectively, while some slow down the digestion of carbohydrates. But what if lifestyle changes and oral medications aren't enough? That's where insulin therapy comes in. Insulin therapy helps to regulate blood sugar levels and is a critical part of treatment for those with type 1 diabetes and, in some cases, type 2 diabetes. Beyond these, there are also newer treatments being explored, such as islet cell transplants and bariatric surgery. These procedures hold promise, but they also come with their own set of risks and are typically considered when other options have been exhausted. What's important to remember here is that every person's diabetes is unique. Therefore, the treatment plan needs to be individualized, tailored to each person's lifestyle, preferences, and health goals. It's a journey that requires constant monitoring and adjustments along the way. Remember, managing diabetes is not just about getting through the day. It's about building a future where diabetes doesn't dictate the terms. It's about taking control of your health and living life on your own terms. In the fight against diabetes, every action counts. Now you're armed with knowledge, but the fight isn't over. Knowledge is power, but it's the application of that knowledge that truly makes a difference. And that's where Vital's Health comes in. We're here to guide you on applying all the valuable information you've gathered. By subscribing to Vital's Health, you're not just subscribing to a YouTube channel, but a healthier life. Let's continue this journey together, learning, applying, and sharing the gift of health. Subscribe to Vital's Health and join the fight against diabetes today.